Initiative to change how your health care is paid for in Vermont is coming to an end.
The state is pulling the plug on OneCare and instead will join a multi-state effort that will continue to pursue similar goals.
Our Calvin Cutler joins us live in studio now. He's been following this for quite a while. Calvin, remind us what the idea is behind OneCare.
Well, instead of paying for each procedure like you currently do when you see the doctor, OneCare Vermont uses an all-payer model that pays providers monthly to keep patients healthy. Now, 7 years since its launch, critics question whether OneCare has delivered a meaningful impact.
It's an organization most Vermonters haven't heard of. And if you're a part of it, you likely wouldn't even know.
Then our real focus is on preventative care and improvement of quality.
Nearly a decade ago, Obamacare allowed Vermont to launch what's known as the all-payer model. Doctors and providers serving about a third of Vermonters are paid flat monthly checks from private and public insurance through OneCare, aiming to help you access primary care, mental health, and in-home elder care. The goal is to improve the overall health of Vermonters, so they would need to access care less frequently, saving money.
It's so key for people who struggle with chronic illnesses. They've seen it as a major source both of financial support as well as information and tactical support.
At the end of next year, Vermont is joining a similar model, partnering with other states, meaning OneCare will come to an end.
OneCare's done its part in this leg of the journey. It's time to pass the baton on to what comes next.
The end of this chapter of healthcare reform has some wondering if it's paid off. In the years since OneCare's launch, healthcare costs have skyrocketed. Small businesses, schools, and Vermonters are dealing with double-digit increases for health insurance. A state audit showed between 2017 and 2019, despite Vermont taxpayers paying OneCare $29 million, there was a $25 million net loss.
It would be bad business to spend $2 to save $1, and our audit roughly found that that's what Vermont was doing.
OneCare denies costs have exceeded benefits, but measuring those benefits is murky. A cost-benefit analysis issued this year from regulators concluded it's difficult to quantify the health of all Vermonters and isolate the impact of OneCare while including other stressors like COVID, opioids, and inflation. But it also shows that it would have cost Vermont taxpayers tens of millions of dollars less if payments were made through commercial insurance and Medicaid.
Things like the pandemic that interrupted this period made it hard to measure concretely what the benefits are. I can only go off of what our quality measures say and what our cost metrics as they were set up to say, and also what we hear anecdotally from providers.
But some still say that if the goal is making you and your family healthy, we as a state should invest simply in more primary care. Reporting in studio, Calvin Cutler, Channel 3 News.